Hello and welcome to the first mini lecture for Abnormal Psychology, Summer 2014. This is over Chapter 1. Chapter 1 can basically be divided into three different areas. What is abnormal? What is the history of mental illness? And what are the models of mental illness that we use? And we'll use these throughout the book. So I know that these first couple chapters aren't as interesting as they will be later on, but it's really important that you understand this information because it's going to come up over and over again. So very briefly, what is abnormal? We actually can use four different sort of terms or criteria to determine what is abnormal. Nicely, they all start with a D, so it's really easy to remember these. We could say that people who are different are abnormal. When we're talking about difference, we're really talking about a statistical rarity. So anybody who doesn't fit under the normal curve of characteristics. So anybody who's really, really, really tall, or really, really, really short, or really, really smart, or really, really not so smart, all of that could be considered different. And we could use that criteria for abnormal, but it's not a great criteria because you wouldn't say that somebody who's super, super tall is somebody who has a mental illness. You'd probably say they have a good shot at the NBA. So different doesn't work out so well, so we don't really use that criteria. You could say people who are deviant are abnormal. Deviant means that you vary from the social norms. So you do something that just isn't a conformist sort of thing to do in your culture. Sometimes people who have mental illness do these things. So the guy on the street corner that's talking to the lamp, yep, that's probably deviant from social norms, and that person probably has a mental illness. However, if you use that term, then you're basically saying anyone who's a nonconformist is also going to be having a mental illness. So somebody with a lot of tattoos, somebody who doesn't like to wear shorts, so they wear jeans in the summer, anything like that could be considered deviant. Not a great criteria for mental illness. You could say dangerous is a criteria, and certainly some people with mental illness can be dangerous, they can be violent towards themselves and towards other people. However, people with mental illness are actually much more likely to be victims of violence as opposed to perpetrating violence themselves. So it's a very small percentage of people with mental illness who are dangerous, and most of the time they're only dangerous for a very short period of time, not all the time. So that is a horrible criteria to use. So what we use in the field is what we call dysfunctional. Dysfunctional can be divided into two different categories. Somebody with a mental illness can have both of them, or they can just have one. The first one is personal distress. So that means that whatever abnormal thing is going on with them, they are distressed by it. So somebody with depression doesn't want to be depressed, doesn't want to be sad. There's personal distress there. The second criteria is impaired functioning, and you'll actually see this come up over and over and over again in the criteria for mental illness. It means that whatever's going on is stopping you from being the best that you can be. It's somehow hurting your life. So again, somebody who's depressed, if they're sleeping all day, if they're not able to get their work done because they can't concentrate, that's impairing their functioning, and that's considered dysfunctional, and therefore we would say depression is a mental illness. So depression can fit both of these, and again, sometimes it can just be one or the other. So this is the criteria that we'll see over and over again. These are the things that I really want you to remember. Now, the second part of this chapter talks about the history of mental illness, and there's a lot to it. The chapter really only gives you a slight snippet, a snapshot of sort of the history of mental illness. There's tons more that we could talk about and learn, but I want you to think about it in terms of this sort of setup. When I think of the history, I think about three things. Etiology, which means the cause. What do people think causes mental illness? What is the treatment of mental illness for that time period? How are they dealing with it? And what is the location of people? Where do they put people who have mental illness? You can then further divide it into these sort of categories that the book talks about. So there's ancient times when people did a lot of trepidation. So if you think about ancient times among these three, they believed that somebody with mental illness was possessed, there was a demon inside of them, and so the treatment was actually to do trepidation, remove a piece of the skull, allowing that spirit or that evil demon to sort of vacate from the brain. People who had mental illness were either treated at home or they were sort of released into the wild. There wasn't a location for them. So that's what it would be under for ancient times. You could use those three criteria as you're going through all of them. So we get into the Greek times where we have Hippocrates and a few other doctors. We start looking at mental illness from a medical sort of standpoint. Then we get into the Middle Ages or the Dark Ages. We move backwards a little bit and we start having more spiritual ideologies, thinking that mental illness is connected with being a witch in some sort of way. We move into sort of the time of the asylums, when the asylums start being built. This is around 1400 when asylums become really popular. And at this point in time, this is all about containment. So people were put into asylums not to be treated, but just to be separated, to be contained away from normal people. Then we move into moral treatment. So we have this movement that starts coming up in the 17 and 1800s about how to treat people who are in these asylums and how to help them with mental illness. And then we move into Joseph Breuer and Sigmund Freud, and we start getting this thing called the talking cure. What do you think about when you think about sort of therapy and psychologists and stuff? Then that sort of brings us into present day. My time is almost up, but I've got one more thing to tell you about. The last part of the chapter talks about these models. We'll see these models coming up over and over again, especially in terms of treatment. And so how would somebody under this model treat this particular illness? So make sure that you understand these particular models. So psychoanalytic comes from the Freudian perspective, where they really look at the past and think that the past is influencing sort of what's going on in the present. Behavioral, where they believe that the experiences you have led you to these behaviors. Cognitive, where they say that how you think about things is much more important than what actually happens to you. Biological, we'll see this more in Chapter 2 as they look at how the neurotransmitters are not working, how the brain is or is not functioning. Social cultural, we'll focus a lot on how your social economic status is impacting mental illness, and we'll see people in the low SES actually have a higher risk. Gender, males and females oftentimes have a different risk for different disorders. For example, females are twice as likely to get depression than males are by the time they reach adulthood. And race, culture, ethnicity, all that sort of can tie into how mental illness is expressed. Finally, we have what we call the biopsychosocial model, which most people use in terms of thinking about what causes mental illness. Basically, it's saying that there's maybe some biological predisposition, some sort of genetic predisposition to them, but then something within the environment triggers that gene, and then that's what's actually causing mental illness. So that's just a quick snapshot of the models. This is a quick snapshot of Chapter 1. If you have questions about Chapter 1, make sure that you are asking them, and good luck on your first exam.